A new study finds colon cancer rates are declining overall, but among Americans under 50 years old, a group not normally considered at risk, the rates are increasing. Dr. Jon LaPook explains why.
3 years ago, at age 33, Dave Neway went to a doctor with a stomachache and was diagnosed with stage 4 colon cancer.
I'm still perplexed as to how this all happened.
Neway is part of a disturbing trend. Over a decade, the number of colon cancer cases in people under age 50 rose by more than 11%. At the same time, cases in people over 50 dropped 2.5%, likely because colonoscopy in that group removes benign polyps before they can turn cancerous. Current guidelines suggest starting routine screening at age 50. The reason for the rise in younger people is unclear. Possibilities include the epidemic of obesity, a lack of physical activity, and America's high-fat diet, all risk factors for colon cancer. Dr. Daniel Labo treats colon cancer patients at New York's Mount Sinai Hospital.
As we learn more, understand the genetic defects that go on with early colon cancer and study some of these younger patients, then perhaps we can hone in on which population of this younger population that we need to screen closer.
Labo says it's important to be aware of symptoms.
First and foremost is really to educate that anytime there's a symptom for colon cancer, bleeding, change in bowel habits, unexplained abdominal pain, that needs to be followed up closely and not ignored just because the patient is under 50 years old.
After 12 rounds of chemotherapy and 3 surgeries, Neway has been in remission for 2 years.
I don't know what it was about that particular dull pain I had that prompted me to go to the doctor, but I'm really glad I did.
Screening earlier than 50 is suggested for those with certain risk factors, such as a family history of either colon cancer or precancerous polyps. In addition to colonoscopy, there are other less invasive methods, such as new tests to look for suspicious genetic fragments in the stool.